All right, so the roll. Chair Fergus Lothridge,
Present.
Brooke O'Byrne,
Here.
Senator Pete Goycochea, Dr. Erica Rist,
Here.
Matt Walker,
Here.
Amanda Osborne,
Here.
Chris McCann is excused, Patrick Rogers is excused, Sarah Dearborn,
Here.
Bryce Shields, and Jerry Sanders is excused. To confirm, Chair Lothridge, we do hold a quorum.
Very good. Thank you. Let's get this thing moving. You guys have waited long enough. Thank you, beautiful people, for joining us on a Friday. We'll get this going. Public comment period. Open this up for folks to join in by computer, to phone, or written comment. I need to read off the phone numbers. I can.
Yes.
You can dial in by 408-638-0968 or 669-900-6833. And when prompted, enter the passcode 139559. We are limiting the public comment to 3-minute period. Is there anyone who would like to provide public comment at this point in the agenda?
And if you are on Zoom and able to do so, you can also use the raise hand emoji. That helps us too.
Not seeing anything, not hearing anybody. We will close that and go to item 3, which is approval of the minutes from our June 7th meeting. Those were sent out to the board members. Board members, you had a chance to review those, and would entertain motion to accept and move forward.
This is Matt. I'll make a motion to approve.
Thank you, Matt. I believe in this meeting, we need to have a second.
This is Amanda. I'll second it.
Thank you, Amanda. Okay, you had a motion and a second to approve. All those in favor say aye. Aye.
Aye.
Or, because we're on such a big group, any opposed? Give the nay sign.
Fergus, this is Sarah Dearborn for the record. I need to abstain because I wasn't present.
Okay, no problem. Okay, with that, not hearing any abstention, so we will pass that and move on into the big topic of today is the review discussion of and provide Valerie with direction regarding our bill draft review for our upcoming legislative session. Valerie has some information on that, been very busy, so I'll turn it over to her.
Awesome. Thank you, Fergus. For the record, Valerie Haskin, Rural Regional Behavioral Health Coordinator. So great news. We didn't really have to dig into any other topics beyond the social work compact. I was able to confirm with the social work board that they did want us specifically to carry the bill. So that's all said and done. Even better news is that there is model language on the social work compact website that must be used. So essentially we just turn in the form with this model language and let this LCB do its thing. So there's really not a lot for us to do on that piece. Other parts that we will need to discuss at this time. It was brought forward during the last meeting to potentially also include language in the BDR that would further change statute in each of the licensing board statutes. So NRS 641, 641A, 641B, and 641C regarding the annual reporting. So with the annual reporting right now, as you saw earlier this year, we got kind of a variety of different types of reports. Some were very comprehensive, and some of them just really met the letter of the reporting requirements, but didn't really have a lot of narrative to explain where that information came from. So thus it was kind of brought forward that maybe we should change this to beef out the reporting requirements. I did have an opportunity to talk with a couple of the licensing boards about that. Specifically, I reached out to the MFT and CPC board because their report was very comprehensive in regards to the type of data that they sent. And they also sent several years work. So we could compare over time. Okay, they are seeing increases in licensure over this time. This is where the increases are. So that was very helpful. I did not get a chance to reach out to the Board of Psychological Examiners that also had a very nice, like 2-page report that provided some narrative as to where the numbers came from and gave a little bit of background. So this week I sent out an email to all of the executive directors for the 4 licensing boards that we tend to work with. So Board of Psychological Examiners, MFT, CPC, social work, and drug and alcohol counselors. A little bit of the feedback I got was that some of the things that we'd like to do, such as getting data regarding where these providers are practicing, really isn't feasible, largely because of telehealth. So somebody may be located in Las Vegas or Reno, but maybe they are practicing or providing services to people across the state, maybe even out of state, depending on what's going on. If they do have licensure in multiple states, or for the Board of Psychological Examiners, if they're already part of an interstate compact. So that could be really tricky. And I think that was kind of one of the bigger things that we wanted to see. Other information regarding the reasons why people or applicants were rejected for licensure was another thing that we had talked about previously. Fergus and I got to tune into an MFT CPC board meeting and got to hear some of that in action. People are wild with what they think may constitute as credentials for licensure. So while I know that we have sometimes get down on the licensing boards, they really are doing a good job of gatekeeping in some respects, at least, to make sure that people who have no qualifications don't start calling themselves one thing or another that they should not be. So that being said, I wanted to throw it out to you guys whether or not you wanted to move forward with that language piece or not, what you wanted to put in. I didn't get any specific recommendations from the licensing boards. What are your thoughts?
Board members that have thoughts on,
This is Brooke. I think it makes sense to, if we're addressing the social work board interstate compacts, I think it makes sense to include the other licensure boards at the same time. So I don't know much
Yes.
more to say beyond that. It just makes sense to build on it.
Yeah, and so the from what I understand, the Drug and Alcohol Board is not in a position to join an interstate compact. However, the MFT CPC board may be interested. However, they will be meeting to vote on that on August 16th. And so in the BDR form, I have not yet, and I'm going to go ahead and put the BDR form up here so you guys can go ahead and tell me what needs to be changed as we go. It's very simple. We just have to use the generic form, so we don't get to use anything too fancy. But with this, let me see if I can move this. All right. Hopefully you guys can see that okay. My eyes are getting old, so I'm having to start to increase the size of everything pretty much. So with this, I've only put in kind of some starter language to introduce, hey, we're going to have the social work licensure compact language attached. And then, hey, secondary, we might be adding in some changes to the licensure reporting. But what I would like to ask of you board members is if with your final approval vote, you would consider including language that would indicate that if the MFT CPC board does vote to move forward with entering into their interstate licensure compact for CPCs, which is called the counseling compact, that we would do so if we could add that language onto our BDR if they vote to move forward. What are your thoughts on that?
Valerie, this is Dr. Rist, and if I'm understanding correctly, really the second part that you're suggesting is not directly related to the interstate compact, but has to do really with kind of tightening up our original BDR from 2 sessions ago, where we got pushed through that the boards would have to provide reports on licensing. And the idea behind that was for there to be more transparency around what's happening with licensing in our state so that we can have really good data to inform workforce development efforts.
Mhm.
So I completely applaud the idea of adding in some language to try to tighten that up. I think all of us were pretty disappointed after that legislation was passed because we didn't end up getting data that was really helpful. So I think your idea of actually having a standardized form that each board would have to fill out with very specific information that would help with our workforce development efforts, and the piece that you were talking about with respect to where are individuals practicing, I think is incredibly important. And I think that can be addressed. Telehealth, I mean, certainly it complicates things, but the boards can each include a standardized question on their application package that would say, which of the following counties do you intend to practice in, either in person or telehealth, and have the applicants just check off which counties they're planning to work in and whether it's going to be in person or telehealth. And I think that would be incredibly important, helpful information for workforce development efforts. And then the other question that you mentioned, which I'm blanking on now, what was the other piece, the other data point that you were going to ask for?
Reasons why applicants were being denied.
Oh, right. Yeah, I mean, I think that's important too, and that's something that they can provide in aggregate form so that it's not identifiable, but just also really helpful.
So here's a question then. I can put together a form and ask the licensing boards to all use this form or this template for the reports,
Mhm.
which doesn't require statutory change. And we could see how that goes until next session back in 2027.
Mhm.
So that way we can work on that and see how that works. The other piece of that is that when someone is licensed through an interstate compact, it's my understanding that the compact itself is the one that has the applications. It's not necessarily the state level licensing boards. I believe that's the case. So they may not have any control over whether or not they can ask, where in Nevada people are practicing. Particularly, Board of Psychological Examiners who's already there, and then hopefully Board of Social Work who would be there after passing of this bill. Hopefully MFT CPC, we'll see.
Yeah. Yeah, we can certainly start there. I mean, I think it's probably to the board's advantage to have a standardized form. It'll make their job a lot easier. The problem though is then there's no mandate for the specific information that they collect.
Yeah.
If we really do want to emphasize the importance of collecting information about where licensees are practicing, that probably does need to go into legislation.
Okay.
Yeah, so I mean, obviously we want to work with the boards in partnership with them. So I think it's probably a good idea maybe to just do some, kind of informal discussion with the the executive directors of each of the different licensing boards to, sort of explain what we're looking for and see what would work for them.
Perfect. And I believe that John Packham's office, the Office of Statewide Initiatives underneath the umbrella of UNR Med, is working on some of the data regarding locations of where people are practicing and whether or not they just hold a licensure and are retired, or whether or not they are actually practicing. So
yeah, so maybe there's a different way to get that information rather than through the boards. But I think the idea is that we want to have clear, transparent, actionable data about licensing in our state so that, Sarah Hunt and her program know where to target, you know, and where to target efforts. So.
Absolutely. Thank you. Fergus, you got your hand up?
Yeah, hearing from the board members and all, I think it would be incumbent of us to, while we have this opportunity for the legislature to include the licensure data in our bill, to set criteria. And if we have to spell, convey to the legislative body, we put this in, but some of the reports we got were not usable. We'd like to tighten that up. I think it needs to be in statutory language. So then there's no wiggle room on, well, we really don't want to, and it's going to take us a while to get our regulations, and we might get to it. Takes that out of there. They don't have an opportunity. We will continue to work with the licensing boards to convey what we're going for so that they can be ready for it. But I think it's incumbent upon us to, if this is an issue, that we get it addressed. And then with respect to the original intent, the primary intent is not so much to call out just the social work as we have there, but to say for the professional licensing boards of behavioral health in the state of Nevada to enter into compacts if their boards deem that they want to do that, and then provide what that language is. I think it just opens it up broadly, so that then if somebody else comes in and says, hey, this sounds like a good thing, I want to be part of that, they can jump in. And it would put in the intent in there that even after this legislative session is over, working with LCB, that there would be a mechanism that they've already been approved to do it. It just takes executive action by their individual boards to do that. Does that make sense?
It makes sense. I don't know that we can put the language in without essentially forcing them into the interstate compact. And as the MFT CPC board has been very helpful, I would strongly urge avoiding that scenario where we push them if they're not willing or not ready.
I don't want to force anybody if they're not ready, but I keep saying I'm sorry. If there was a mechanism by where we're putting this in September or October, that we get this in front of them, that there's an opportunity, and that the state's approved it.
Okay. So a fix here would be when you guys vote at the end of this action item, we can have the language in there already for the Board of Social Work. When you make your final vote today on the BDR, again, you can add in, if the Board of Marriage and Family Therapy and Professional Counselors votes to move forward with entering into the counseling compact, add that language into the BDR before submission. I just don't want to have you guys approve the BDR as it stands and then not be able to add it back in before the September 1 deadline. That's my only concern. And that's why I would ask for it to be done that way. That way we're respecting their wishes as to whether or not they want to move forward with it. But then also we have the option to add it in if they do decide to move forward, because we've got that like 2-week window.
Yeah, and just for the record, they're planning on meeting in August, so we should be able to have something back from them to make that inclusion if they deem necessary. I'd be good with that. Board members, thoughts? I think with the licensure data, we put it out there generic enough for them to submit data. We didn't tell them what that criteria was going to be. We need to be prepared to provide that criteria that's going to go, that's going to be useful. So we can work through that.
Okay. All right, so then here's what I'm gonna do. I'm gonna leave, we've got the primary and secondary. With your vote, I will add in language here for the primary as well as here when we're describing a statute that will be affected for the MFT-CPC board if they decide to move in that direction. Does that work?
I believe that would work.
Okay,
And then for the
Um,
licensure data would be criteria as defined by whether it's this body or whatever, but we need to define what that those data points will be that we want them to report on.
okay, perfect. So I've got right now just details are attached. Do we want to play around with some of those details? Just so that we have that. So changes will include adding in language to detail reasons for rejecting applications. What were the other ones? So we can't okay. We maybe not add in location of practice because we may be able to get that somewhere else.
Did Dr. Riss say delivery of services? I thought she mentioned, like, would it be telehealth delivery?
Type of delivery.
Okay, so types of services and delivery. Or wait,
Type of service delivery, maybe?
service delivery. What about specialties if known? Or specializations if
Be
known?
good.
Mhm. I do kind of hate letting go of finding out what parts of Nevada people are planning on working in. I mean, I understand that may be difficult data to get, but I don't know. I think we need to talk to the boards and see if, is there a possibility of, adding a question to existing applications, or I don't know. Because especially for us being concerned with rural counties, it doesn't help the rural counties if we license providers that are just planning on working in Reno and Las Vegas.
Right.
So,
Well, and what if we are massively successful in getting more providers who are willing to practice in our region, but maybe not the southern region, which is the frontier counties in the southern part of the state, right? So,
exactly. So the level of detail down to the county would be really helpful.
okay,
This helps also drive whether or not they're just getting a license to maintain their license because they've had it for eons and they're not really practicing, or they are practicing.
Mm-hmm.
okay.
And there was a question in the chat. Is there a reason licensure boards do not track location of licensees now? Other than it's the cumbersome of them trying to drill that down at this point is my understanding, Joseph.
Yeah, I think so. They have, I think, physical location as far as like mailing address, that sort of thing. And that I know that OSI prints that and uses that data to determine kind of what counties have how many providers. So when you look at the data as far as like who's located where by county, that's where they get that piece. But again, with telehealth, that doesn't necessarily help with where they're practicing, nor does it necessarily delineate out whether or not they're actively practicing or just maintaining their license while retired. Again, I believe OSI is working on delineating out between those who are just maintaining their licenses and are retired versus those who are actively practicing. So that is something that, we may or may not get, or that may already be fixed.
Even if it's being fixed, I think the report that they provide to us needs to include that, whether somebody else is tracking that or not. And we have to go try to mine that information ourselves, or it may not come around. So I think that would be important for us. The intended county or region of practice should be specified.
And just to update on where that data can be found, it's published biannually in the Rural and Frontier Health Data Book from Office of Statewide Initiatives. OSI tries to publish that before the start of each legislative session, so everyone has it in their hands while reviewing policy. But I believe it's updated on a regular basis, not the book itself, but if you use Nevada Instant Atlas, which is also on the Office of Statewide Initiatives website, that would be another location.
But I think, as you pointed out, Valerie, the methodology of how that data is collected is really important, right?
Yeah.
So if it's only based on mailing addresses of practices, there could be folks that are, primarily based in Reno, but, drive out to Winnemucca a couple times a month or whatever, and then we're missing those people.
Okay.
Exactly.
And something else to think about is that as we move forward with this BDR, we can submit this, but we do have the opportunity to hone down the language before final submission in December. So if we propose some of these changes and we have the opportunity to have more conversation with licensing boards and, hey, we can do this, but not that, then we can effectively change the language in the bill draft request, or in the draft language anyways, before final submission and creation of the bill. And that would be like November of this year.
Yeah, I think we've captured the intent, and hearing the dialogue from the board members and the public, that we've captured that part of it. And now this will get the first request in, and then we can, like you said, we'll hone the language in the actual statutory requirements.
Okay. All right, so the language I have here now going in section 1, the primary intent of this bill will be to enter, the Nevada Board of Examiners for Social Workers, or BSO, into the Social Work Compact, the applicable interstate licensure compact for their providers. The secondary intent of this bill regarding licensure data reporting is outlined in the attached documentation. Because I was thinking this was going to be a lot more detailed bill. So I'm going to go ahead and change that. Secondary intent of this bill is to add very detail to the reporting requirements of the behavioral health licensing boards. Okay, section 2. If known, list any existing state law that is sought to be changed or which is affected by the measure. So NRS 641B will be affected to enter into the state social work licensure compact. The model language that must be used has been attached. The following statute will be altered to standardize licensure data reports to the regional behavioral health policy boards. NRS 641.145, that's for psychologists. NRS 641A.183, that is for marriage and family therapists and clinical professional counselors. NRS 641C, which is for the Drug and Alcohol Board, and NRS 641B.165, that is for the Social Work Board. Changes will include adding in language to detail reasons for rejecting applications, type of service delivery, specializations if known, and intended county or region of practice. How does that sound so far?
Good.
All right. 3, any additional information that may be helpful in drafting the bill or resolution. So model language for the Nevada Board of Examiners for Social Workers to enter into the Interstate Licensure Compact has been attached to this email. Effective date. The Social Work Board and their lobbyists requested that the bill may be made effective upon passage and approval so that they can immediately enter into the Interstate Licensure Compact.
Valerie,
sir.
on 3, it focuses just on the compact where we had a secondary part of with the licensure data. So we need to add that additional information of the criteria as to be determined by the Rural Regional Behavioral Health Policy Board
Okay.
for licensure data.
Data reporting will be determined. Should I say in conjunction with the licensing boards affected? Or just leave it be?
Leave it be.
Okay.
I'm thinking broad brush. We're gonna have some that get on board with it. Yep, we can do that. And then we have the other ones that we have historically drugged their feet and have not been responsive to some of the requests that we've asked nicely. We need to get to the bottom of it, and it's important for the delivery of behavioral health services in the state of Nevada, so we all have an understanding.
Okay. Description of any known costs to the state or local government that would result from carrying out the changes in the measure if enacted. Potential costs to the Nevada Board of Examiners for Social Work associated with processing information regarded to additional licenses through the interstate licensure compact or the social work compact. Okay. How does that sound?
Also, there may be potential cost to the behavioral health licensing boards, the professional boards, for whatever that might be to capture the data points that we're requesting. And when we keep saying the social work compact, do we want to call it the National Interstate Compact for Social Work? They refer to as the Council of State Governments National Center for Interstate Compacts reviews the state compact legislation to ensure consistency with the model language. So
Okay.
if we say just social work compact, it's like, what is that really?
Okay.
We're taking a national model and inserting it into Nevada.
Okay. What was,
That's
can you
been
read
well
off the,
vetted.
can you read off the title to me again?
It's on the cover sheet of their model legislation. Council of State Government National Center for Interstate Compacts is the one that actually reviews the state compact language. They're in italicized in the second paragraph there.
Okay. Council, okay. So that is the organization that runs it, but that's not the name of the compact. So the Council of State Governments National Center for Interstate Compacts reviews the state compact legislation to ensure consistency. So I believe it's just called the Social Work Licensure Compact.
Just said interstate social work licensure compact, maybe that would
Okay.
That would help drive that it's not just some compact that's going to be within the borders of Nevada compacting. I don't know. This is a interstate compact.
Okay, let me see if I can, I've got too many, this silly bar up here for the whatchamacallit. Need to hide the video panel. Nope. Okay, it won't let me grab the menu piece. There we go. All right, let's see if I can grab this. Form, here we go. Okay. Interstate Social Work Licensure Compact. Okay. Okay. All right. Does that work?
I think that captures it a little bit clearer.
Okay. All right, so do we need to go back through it, or would you like to go for a vote? Do we want to change anything else?
Board members, thoughts, concerns?
I think it sounds good.
I hear Matt saying good and lots of thumbs up from Dr. Riss. So make the motion in the second.
Oh, before someone makes a motion, please remember the suggested, recommended motion would be to approve the BDR form for submission as is with the attached documentation for the social work licensure compact and the ability to add in for the counseling compact pending the approval from the Marriage and Family Therapy and Clinical Professional Counseling Board. I know that's complex.
Okay, I would like to make a motion. I would like to recommend approval of the current BDR proposal as written, with the addition of the possibility, if the CPC MFT licensing board becomes ready to enter into their own interstate compact, that this BDR would facilitate that process for them as well. and that we will also include required data for collection by the licensing board to better inform workforce development activities.
Awesome.
I'll second it. This is Amanda.
That was Amanda second.
Yeah.
Okay, any other questions, concerns? Board members, because we have so many, anybody opposed? Any abstentions? I'll take the silence as an affirmative, so we will pass. Unanimously. For those present. Excellent. Valerie, anything else on that topic?
Nope, thank you.
Awesome. Thank you, folks. A lot of work. Next, let's go to item 5. Dr. Hunt, I believe, is on, and this will be for the update regarding the outcomes of our previous session, Assembly Bill 37, and the development of the Be Here Nevada, the workforce bill, and some of the progresses that are being made. And I'm gonna go on mute here and exit video and close my office.
Okay. Good afternoon, everyone. This is Sarah Hunt. I'm Executive Director for Be Here Nevada. Let's see. I'm trying to remember what we highlighted last month. I would say over the summer, we have not been as active in especially the K through 12 space, simply because the students are out of school for the summer. But in this past month, Dr. Jill Mannett and I, one of our staff members for Be Here, we were able to present at the Nevada Association for Career and Technical Education. So we were able to introduce those educators who are teaching career and technical education classes and programs in the high schools, and inform them about Be Here. We got to meet with a couple of teachers who teach a health and human services track in a couple of the high schools in Northern Nevada. So that was a great opportunity to start building a relationship with them and talking about how we can provide some content about mental health careers and education pathways. So we were excited about that opportunity. We also just had a table down here in Southern Nevada earlier this week for a conference put on by the Safe and Respectful Learning Office at Department of Education. So we were able to, again, connect with more educators about Be Here Nevada. You mentioned data, so we will be closely following your bill going into the next session. We do continue to work with Dr. Packham's office, and we're hoping to be able to support hiring a data analyst in his office that would be solely dedicated to Be Here's work. So we're continuing to work on getting that position approved and posted, and hopefully have someone in that spot in the next couple months. We're also completing a search right now for a third associate director for Be Here Nevada, which we're calling the Associate Director for Technical Assistance and Policy. So in the Assembly Bill 37, you all had kind of called out specifically wanting a place for those individuals who want to start a new practice or clinic in Nevada, have a place to go to find out how do you do that? Where do you get your business license? Who are all of those professional licensing boards that we have? And so we want to bring on that third associate director to oversee what that will look like, what that programming will look like, but we'll really focus again on the technical and business side of doing mental health care in Nevada, as well as hopefully with the information we start getting and the data that we track, some policy ideas to take forward into future sessions. So again, we're starting some interviews with that position. Hope to have that spot filled in the next couple months. One other exciting thing I'll just highlight. We received a grant from the state earlier this year to offer some scholarships. We wrote, I know it's so exciting. In the interest of recruiting and retaining some future mental health professionals, we were awarded money to put towards 12 scholarships for this fall. And those scholarships are spread out across the School of Social Work, the Marriage and Family Therapy Master's Program, and the Mental Health Counseling Master's Program at both UNR and UNLV. So we are offering 2 years of tuition and fees for 2 students for each of those 6 programs. So that adds up to 12 scholars that we will be supporting for 2 years. We are just notifying those students that were selected by their programs to receive the funding. The funding from the state really wanted these scholarships to go to students who first had a financial need in supporting their education, but also had a connection to Nevada and a plan to stay and work in Nevada. So it's been a good week in notifying students and getting their responses back. I'm very inspired by the 12 scholars that we're connecting with. Another piece of that scholarship opportunity is the ability to work with a mentor as well during the next 2 years. And those mentors are mental health professionals that work in the communities in Northern and Southern Nevada, who will be a regular contact for those 2 students per program. And really, we want the mentors to not so subtly continue to encourage those students to stay in Nevada after they graduate, connect them to, the provider communities. So I think those were the highlights that I want to talk about today. Happy to answer any questions.
Dr. Hunt, have you shared this with the newly launched Behavioral Health Association of Nevada?
Sarah Hunt, for the record, no, we have not.
So I'd love to send something along to Steve Shell if there's anything regarding that. I think that's huge and so exciting, and it's really exciting to see that stuff come forward, because I believe that's earlier than originally intended when we built out the plan. So that's super exciting, and I'd love to share that news.
Sarah Hunt, for the record, thank you for that. We hope to also highlight that in our upcoming newsletters, as well as feature the scholars in our newsletters, so you all will get a chance to get to know them as well.
Great stuff, Sarah. Board members? Comments, questions? Excellent. We'll continue to invite Dr. Hunt to our meetings so that we can just get the first take on the new information as it comes available. It's exciting. Thank you, Sarah.
Thank you. And again, thank you all for your ongoing support. We appreciate it.
Okay, let's go to item 6. Valerie, this will be your update on challenges, resources, and other work that's going on in your life professionally.
I'm on mute. Figures. You'd think after 5 years I'd know how to work this thing. So I just wanted to check in. It is 2:01. Are you sure you want me to move forward?
If you can,
Keep it brief.
the high points, the executive summary version, if you would, please.
Fair enough. Fair enough. Okay. All right. So it's been a busy last couple months. Unfortunately, I've had to kind of step away from the task forces as I'm working in separate projects that would be a part of task force work, just kind of in the interim. So I'm hoping to relaunch those in September after everybody comes back from summer break. I know it's really difficult to get people to meet in the summer anyways, so I appreciate it. As far as training and travel, I did have the opportunity to go to the Nevada Sheriffs and Chiefs Association summer meeting in Ely last month, And there, my counterpart Sherilyn and I had a really great opportunity to garner feedback regarding kind of what's going on. We were also able to build and present a guide regarding behavioral health services and how that fits in the sequential intercept model, just to kind of help them understand where the different pieces fit. This was also only services that we're aware of at this time. And right now there's a ton of money coming down at the federal level for behavioral health in the criminal justice system and diversion programs. So it's been a little bit of the reason why we decided to have this conversation and build this guide was because we know that a lot of our sheriffs and chiefs were getting cold calls from different state offices, different private organizations, different nonprofit organizations regarding what they have going on. And so what we wanted to do was be like, okay, this is what's going on. This is what's evidence-based. Here's where this would be, you know, first point of contact with someone in crisis. Here's something that would be post-arrest, but, you know, pre-hearing, et cetera. And then this is a program that would be for preparation and after return to the community. So we kind of spelled that out. It's posted on nvbh.org, which, by the way, is where I've been posting agendas and meeting materials because we haven't been able to really hit the turnaround time with the DAG to post things to the state website, but we can still maintain open meeting law and post things to NVBH. Also, the state website said that it will post agendas for us, but they don't want to post the rest of all the supporting materials just because it does take a lot of time. So everything's just going to be over on nvbh.org if you're looking for agendas and meetings. So just a heads up. But that document is over there too. Let's see, I am currently working on planning for a CIT training that will be based in Winnemucca the week of November 18th. We have identified many of our speakers and we have our assignments as to who's going to reach out to our subject matter experts. But I think we're going to be good to go on that. So that's going to be very exciting. That's going to be focused on the Tri-County area of Humboldt, Lander, Pershing, but will of course be open to other jurisdictions as well if they want to send members. So across our region as well as the rest of the state. I'm going to be going to CIT International at the end of the month and the Ruby Mountain Mental Health Summit in September. I did get to be a co-trainer for Assist in July. So that was my first time going through that one. It wasn't nearly as bad as they make it out in the training for trainers. So that was good news. So if I do need more Assist training, so if you are interested in hosting an Assist training, the Nevada Office of Suicide Prevention has kits. And there are a lot of trainers looking to get their trainings in. So we can probably make it happen for cheap to free, usually free. So please reach out to myself or to Taylor Morgan, more specifically if you're interested in scheduling either an Assist or Safe Talk training. The AG's office, I believe, submitted the application for the COSSUP grant. COSSUP is the Comprehensive Opioid Stimulant and Substance Use Program, and that comes from BJA. The way this grant program works is the state AG's office applies for the grant and then manages it and subgrants it down to other organizations. Last time they received the funding, it was more focused on the western part of the state. So I worked with Dr. Terry Kearns at the AG's office to really make sure that this time we were also focusing and offering these resources to law enforcement in our region as well. There's going to be a most and most like program for Elko and then into the surrounding areas. Most like, so most, for those of you who aren't familiar, I see some new names on the call. Most is a co-response team for persons in crisis. That is a law enforcement officer co-responding with a clinical provider. Most like is a co-response team, which is a law enforcement officer with a peer or CHW who is trained to recognize, to de-escalate situations, recognize mental health concerns, and then they will refer to a provider that they have on tap. So we're going to work on building out that most like program into Eureka and White Pine counties, but Elko itself will have a most program. And then we're also going to do a most and most like that's going to be a little bit more hybridized and stood up probably a little bit faster across all three counties with Humboldt, Lander, and Pershing. Elko County Sheriff's Office is going to be building a FAST program if this funding is awarded. And then this would also include the opportunity for approximately 8 CIT trainings across the 3-year grant period, as well as opportunities to get multiple folks trained as trainers and really build out our CIT training infrastructure here in Nevada so that we have more in-depth opportunities. And it's not quite such a heavy lift. We're not taxing the same people over and over. We have subject matter experts and trainers across the state, so we won't see as much travel. Also next week, I have a meeting with my counterparts and Cody Finney and Drew Cross, who is the administrator for Lakes Crossing. Cody Finney is the administrator for all of DPBH at this time right now, or again. And we're going to be meeting with all of the law enforcement agencies who show an interest in wanting to kind of learn how to iron out processes with Lakes Crossing. Lakes Crossing has data regarding wait times. Our law enforcement officers have data regarding wait times. It sounds like they're not the same, so we need to figure out where that gap is, and also make sure that everyone's trained on the correct processes to make to get into Lakes Crossing, or get inmates into Lakes Crossing rather, so that there aren't any unnecessary lag times because they thought something was done and it wasn't, etc. Still working on the life and social skills curriculum. Legislature. I was not able to tune into the Northern boards meeting yesterday. However, my understanding is that the Northern and Washoe boards are probably going to be focusing really on community health workers and peer recovery support specialists, specifically payment parity, which I think is what the Washoe board is likely going to be going after, although I don't think they finally decided. And then last I heard, the Northern board was going to be looking at the oversight for peer recovery support specialists, at what and how they can eventually kind of move on to like their own practice per se, but they don't need oversight as a peer recovery support specialist if they've been doing it for 20 years, because otherwise it's like an unending internship. There's already quite a bit of continuing education credits that they have to take and other things in order to maintain their licensure as a peer. So that's something to consider. Still looking at potentially doing a statewide behavioral health policy summit in January. I was going to probably have to do it online. However, I may have access to additional funding through the mental health block grant that I could probably use for this as well. In which case, this would be one of those things where we would post it as an open meeting, because we'd want as many of you all there, as well as members of the other boards and the general public, to come forward and we talk about policy, what to expect for the next legislative session, and also have some workshops for people who aren't always involved in the legislative process, regarding how they can engage with legislators depending on their role. Because after all, if you are funded through money that comes from federal grants, you can't lobby. So what can you do? Not engaging in any other research at this time other than what I've already mentioned. And as far as opportunities and suggestions, you know, I think depending on how this meeting with Lakes Crossing goes, we might try to do more meetings with some of the administrators of different state offices, with key stakeholder groups that tend to have a lot of difficulty, and try to figure out how we can iron out processes and get kind of a clear understanding of what's going on. Again, I do have the option for applying for more funds related to my scope of work for federal year 24 and next 25. It would have to be expended by March 31st. So if you have any ideas of things related to my work that we would like to take on, please let me know. I'd love to hear them. I'd love to get the biggest bang for buck. Unfortunately, this cannot be used for service provision because that's not what I do. And so that they won't let me apply for stuff to hand over to somebody else for that purpose. And that is the brief rundown. I will send this out as well. Any questions?
Trying to get back into the meeting. This is Fergus, just trying to get back into the meeting. I've been listening to you there. Any questions from the board?
Recording in progress.
Okay, no questions, and I'm back online. Had a bump in our out there, so a lot of stuff going on, a lot of excitement there, Valerie. Thank you. All right, next will be our public comment. Again, a section, maybe talk about anything that you heard previously in the meeting. Same dialogue, call in 408-638-0968 or 669-900-6833. And when prompted, enter the passcode or word 277208. 277208. 3 minutes. Anybody wish to have a little time to jump on?
Fergus, this is Sarah Dearborn. I just have a quick comment to make. So this is Sarah Dearborn with Nevada Medicaid. Just wanted to put out there that Nevada's crisis state plan amendment was approved this week. This has been about 2.5 years in the making, so I'm sure if you've been on public meetings with me, I've sounded like a broken record of when this will get approved. But what that does specifically is provides reimbursement from Nevada Medicaid for providers of intensive crisis stabilization services. Those providers are also known in our communities as crisis stabilization centers, so they'll be able to receive a daily rate. And then further down the line, we'll be able to not only reimburse for hospitals that are endorsed as a crisis stabilization center, but also community facility-based providers of intensive crisis stabilization services. It also allows for mobile crisis reimbursement for what Nevada calls designated mobile crisis teams. There is more work to do in the crisis world with rates and items like that we'll be further working on, but at least now we have the lever to reimburse for that facility-based piece. And I know, Valerie, during your talk about all the work that's going into building up a lot of the mobile crisis response teams in the other counties, I think that this benefit will help that if they so choose to be a Medicaid provider. But further work will be done on that, but just wanted to put that out there.
Awesome. Thank you, Sarah. Other public comment? Not seeing or hearing any. We'll go to the next item. And before we adjourn, just to remind board members, our next meeting is now scheduled for October 4th at 1 p.m. Make sure it's on your calendars to be there for that. And we have our information. Valerie has the criteria for getting things submitted, and we'll have more update on where we're at with our bill draft as we work with LCB possibly by then, and the other boards. Valerie, did you have any closing comments before we adjourn?
Not at this time, but I will send board members updates as things unfold with the BDR and anything else that comes up. And if you are a board member and there's an update you would like me to send out to everyone, please let me know.
Awesome. Okay, with that, I will call for adjournment at what to look like 2:16 p.m. And thank you, wonderful people. Have a great weekend.
Thank you. Bye-bye.
Thanks, bye.